Hey everyone, welcome to the Canine Culture Podcast, where we talk about everything dog. Q&As with veterinarian professionals, rescue operators, everyday topics. We cover everything dog on this podcast. So make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media on both Instagram and Facebook. Thanks again for listening. Now here's that next episode. Hi, everyone. Welcome to the Canine Culture Podcast. This is your host, Brittany, and today we are joined by a repeat guest. We are here with Dr. Katie. So good morning, Dr. Katie. So today we're going to talk about a topic that is uncomfortable, that is controversial, we could go on and on just talking about how people feel about this topic, and it is behavioral euthanasia. So before we get into it, and everyone just sit down, take a breather. It'll be okay. Let's just talk about you, Dr. Katie. For anyone that doesn't know you, just give us like a little bit of intro on who you are.
Okay. So I'm a veterinarian and I practice in home, and my practice is exclusively end-of-life care. So that means euthanasia and some hospice and palliative medicine, but mainly euthanasia in the home.
And that's amazing. And it's such a need. I know so many people that you've helped here locally in Jacksonville, Florida. So Katie's great at what she does, and that's why she's here. Now, let's start with defining what is behavioral euthanasia.
Okay. It is a very, very broad spectrum, very highly sensitive, high touch topic. Period, point blank. Just like as we've always discussed, I think euthanasia itself is so sensitive. So when you add this layer, I would say for this particular podcast episode, for all intents and purposes, we can say behavioral euthanasia can be due to aggressive behavior. Now, we can always come back and talk about this in different way. Inappropriately urinating could be considered behavioral. There's a lot of different ways that we could go with this, but I would like to say this is not something that I normally do. This is not something that I'm normally reached out to help a family with. And when we are contacted for what we would consider a behavioral euthanasia, it's something that we handle with a lot of sensitivity, and we listen to the family and we get as much information as we can, hopefully working with another veterinarian that this dog or cat has worked with. And we handle it with as much tact and grace as possible, because it is a very, very emotionally charged topic, period, point blank. It's very difficult. And my thoughts on it have certainly evolved and changed over the years. But I would say behavioral euthanasia for this particular conversation can be for aggressive behavior. And then we can talk about, the different levels of that.
Yeah, so let's talk about aggressive behavior. I think more often than not, people think aggressive equals a dog that bites. And well, there's a few ways to even go with that. Number one, that's not necessarily the definitive definition of aggression. But then also, a lot of people think biting, aggression, bad dog. And it's not always so much, I don't want to call them a bad dog. It could be driven by a health issue. It could be driven by previous trauma. And so, anecdotally, I'm just going to throw in a story. We have a neighbor. They used to have a pit bull, very, very aggressive. And we found out that the aggression was actually due to all of these brain tumors that were inoperable. And so it seemed that as time progressed, the tumors got larger, the dog got more aggressive. Now, he had good days and he had bad days. As the tumors got bigger, he started to have more and more bad days. He started biting more people, and ultimately he was euthanized. And so that was interesting, because it is on a spectrum, if you will. I think a lot of this is on a spectrum with respect to their health. So his health continued to decline, to go down that spectrum. And then his behavior kept declining, so much so that he was biting his owners. He was biting the kids in the house. He was attacking everyone and everything. With that, he had no quality of life. He was constantly confused. He didn't know who was
Yeah.
coming after him. He didn't know what was going on. And I think people need to be able to separate, like, hey, this dog isn't just acting out for no reason. They quite literally don't know what they're doing at this point. His brain tumors had progressed to that
Yeah.
capacity. So,
I wouldn't even consider that a behavioral euthanasia. I mean, that is, I mean, I know that because of his disease, he's biting, but I would definitely say, I mean, I've had cases like that, of course.
right.
And it's terrible. And kind of adding on to that, another I wouldn't necessarily consider behavioral is this happens a lot, senior dogs that are
Hmm.
either startled upon approaching, like if you're in a sound sleep and you pet them and they, jerk back and bite,
Right.
or if they have really bad mobility, arthritis, and you go and lift up to help them up and they bite. I mean, that's their
Hmm.
voice. They're saying, ouch, that hurts.
Right.
I, for a very specific case that I'm thinking of recently, that I was reached out. First of all, can we jump into a case that
Yeah.
I would really truly consider behavioral? Okay.
Yeah.
Um, it was a, it was a wonderful family. They have 3 small children. They have 3 other dogs. They've had this dog rescued from the shelter since she was, I think, 4 or 5, and now she was 8 or 9.
Hmm.
She never was really uh, she was never really great from upon adoption. And the owner, ironically, is actually a dog handler and trainer, and he has worked in shelters. And they lost their other senior dog last year that this dog really bonded to and attached to.
Hmm.
And after that, it wasn't necessarily aggressive tendencies, but she started hiding and becoming so reclusive and urinating on herself, would not leave the bedroom when you tried to move her or help her. Now, this is the family she's been with for 5 or 6 years.
Hmm.
She would growl. It was very difficult. Now, this is where I become very, very sensitive to the family. They tried every single medication you can try. They worked with their veterinarian. They moved, she had her own little room. They removed all stressors possible. They tried for a year,
Hmm.
and they were still very hesitant and very emotional at the end of that year to say, okay, I think it's time to euthanize. She had 0 quality of life. She would not walk outside. And was there anything physically or physiologically wrong with her? She was a 9 or 10-year-old dog. I think she had a little bit of arthritis. Mentally, she had just was shut down. And it was very, very difficult for the family. Um,
Hmm.
and I approached that case with a lot of sensitivity, and I felt at peace knowing what they had been through, knowing what this poor dog has been through,
Hmm.
to euthanize.
Right.
Putting her in another home wouldn't have been helpful.
Right.
Because I think that's what everybody always grasps at is just rehome.
Right.
Well, just take to the shelter. That is probably the worst case scenario, to put a dog that is either shut down already in a home that it's been in back
Hmm.
in a shelter situation.
Hmm.
Um, Another case that I am approached with a lot is dogs that are biting unprovoked and unpredictably. Those 2
Hmm.
things are really, really a dangerous combination. So I wouldn't consider a dog that's resource guarding unprovoked or unpredictable. Those
Right.
are very, very predictable circumstances. I think
Hmm.
that's the family's responsibility to try to control as much as possible.
Yeah.
Um, like if a dog, I had a friend that had a dog that like growled as she ate her food,
Yeah.
like her
I've
whole
seen
life,
a
and
few
like
of
was always
those.
like looking over her shoulder, like, you
Yeah.
know, that's predictable. Don't go near Missy's bowl when she's eating.
Right.
Definitely don't, like don't try to give her a bone and then take it away. That's just her. She was just
Hmm.
very So that's, I think, very predictable. But an unprovoked and unpredictable bite is just a recipe for disaster.
Hmm.
And so those are the cases that I really will take a second look at and a deeper glance at of like, what have you tried? Have you tried medication? Have you tried training? And I think honestly, Brittany, I never shut a family down. I listen. I
Hmm.
never want them to feel judged.
Right.
If it's not something that I feel comfortable with doing, I would never pass judgment and say, like, no, we don't do that. But we need to talk about a next step or another plan to keep the family safe and to keep the pet safe.
Right. And I was going to get into some of the steps people can take prior to making that decision. You mentioned medication, of course, speaking with your vet, seeing what your options are. Do you have options for medication? And then, of course, you can expand on these, but training, sometimes maybe you've worked with a particular trainer. Maybe you need to move on to a behavioralist or
Hmm.
someone who's very well versed in behavior training. And those are really the ones that come to mind. Otherwise, lifestyle changes. If it is just resource guarding, hey, let's feed the dogs in separate rooms from each other. Let's keep the doors shut until they're finished. Let's be very careful about bowl pickup, etc. So, what are some things that kind of come to mind to you, or like, what are some things you ask the family with respect to steps? If they call, maybe they call you and say, I'm getting close to having to make this decision. I've done ABC. What else can I do? Do you have advice on that?
Hmm. Yeah, I think training is beneficial to a certain point. I think it's more training us as the owner
Yeah.
rather than the pet. Um, Other than that, getting a background and a history is very, very important for me. Like if we find out that um, we have a dog now that is showing aggressive tendencies, what are the circumstances? Are they predictable or provoked circumstances? Is it a toddler that's pulling the dog's ear?
Hmm.
Is it a puppy that was brought into the home that is challenging this dog? Have they moved? Have they added a stressor to the home? Have they tried medication? Have they reached out to a veterinary behaviorist? Because there are a lot of different levels. Now, all of those things are very time and financial intensive.
Hmm.
So again, being sensitive to that, um, not a lot of families can afford time, safety wise or financial,
Hmm.
all of those things that I just said. But I am very, very mindful to talk to the family about what have you tried? What are you willing to try? What can you try?
Hmm.
And are you safe? Are you safe in the home? Do you have a child that's 2 or 3 years old that this dog is now baring its teeth at? To me,
Right.
that's not safe.
Right.
But, um, it's, these are very, very, again, I can't say this enough, very, very sensitive topics that,
Hmm.
um, I don't ever want to shut a family down, but I'm willing to help if I feel it's appropriate.
Yeah. And I think certainly your focus at all times is that quality of life piece. So balancing the dog's quality of life along with that family's safety and well being. And much like any other euthanasia, at an older age or with a medical condition, so you've got that sliding scale of a quality of life. And once that tips one way or the other, I think that that's a pretty good delineation that euthanasia is on the horizon.
Yeah, and more than anything, not just for the pet's quality of life, but for our as the owner's quality of life. I think about there's just such a precious human animal bond that we have. And when that's starting to be broken, I've had so many families, I wouldn't consider this behavioral, but I've had so many families break down to me at the end and say, like, I'm starting to resent my dog for, peeing all over the house and pooping all over the house because, and I had that. I mean, I had my 15-year-old lab was doing that, and I did
Hmm.
not realize that it just it is, it's like a labor of love. I will take care of her at the end, but then it really does become a quality of life issue where not just for the dog but for us as the owner.
Right.
um, so when I have families reach out to me, say that they're living in fear of their dog, that's a huge indicator that something is very wrong, that there's baby gates all over the house, that they can't leave the dog with anybody else, because if that if one baby gate is open by accident and another one is, I mean, the stories I've heard of, I helped a wonderful family. This was years ago. This was probably 7 or 8 years ago. They did literally everything. They built like an 8-foot fence in the backyard.
Oh, wow.
It was a very, very unfortunate situation, but they had a doggy door, and the lawn guy left the gate open, and the dog got out, and there was a thunderstorm, and the dog was very scared and just went out of the yard and attacked a small dog in the street. And it was horrible.
Mm-hmm.
And there was, animal control had to get involved. And of all of the things that were in place,
Mm-hmm.
it just did not work out.
Yeah.
And so, I mean, I have hundreds of stories like that, but just to differentiate, if a family calls me and says, because you and I were just talking about this before we jumped on,
Mm-hmm.
I have a dog that I just rescued from the shelter who's biting and digging holes in the yard and just shredding pillows. But like, he's a puppy. There's a very big difference when he's running around chasing my kids and mouthing at them. That's not a behavioral euthanasia case in my opinion.
Right.
We are talking about really serious already. And the other thing too, Brittany, I have to say this is, I would say 99% of the time that I've helped a family through a behavioral euthanasia case, they have already had recorded bites that have needed medical attention.
Right.
And so they've had those warning signs. They've had somebody get hurt. It's almost always like one bite too late that I get reached out to. And then those are very difficult cases.
Right. It's almost, in an odd way, though, comforting to hear you say that, because I do like that people are trying. So I do like that we have owners out there who are like, okay, one bite, one accident, let's try to move past it. Let's try to remedy this. So the flip side of all of this is that it is nice to hear that we do truly have owners that are caring and trying and not just saying one bite and done. You know what I mean? So that's kind of the odd way to look at this positively, if you will.
Yeah. And that's what I feel. Yeah, I feel very, I don't know. I feel very privileged that the families that do tend to reach out to me have tried everything, and they trust me and my judgment that this may be the best decision for the pet and for their family. But it is just one of those things that, as a veterinarian, we're faced with it, and everybody has their different ideas about it. But I think with all things, like, we have to be kind to one another, and we cannot pass judgment. And just if you listen to a family saying that they're scared of their own dog, and the ones that are, I feel like, the most responsible tell me, I don't want to put this onto another family.
Right.
I don't want to bring my dog to the shelter in hopes that it may get adopted to another family and the same thing happens. I think that's a very responsible way to look at it.
Absolutely. Yeah.
So,
well, thank you so much for the work that you do. I know it's very difficult work, but it is so necessary, and we appreciate you just educating us on this topic. I hope that some people really take away some of the key pointers from this. So thank you so much.
Thank you, Brittany.
Thank you for tuning in to the Canine Culture Podcast. Please make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media. If you have any recommendations, any topics that you'd like to hear, if you know of any guests that would be good for the show, or if you yourself want to be a guest, please reach out to us. Send us an email at canineculturepodcast@gmail.com, or send us a direct message on social media. Thank you for listening, and please share this with any of your dog-loving friends.